it's the bottom of the eighth. The Red Dogs are down 3-1. They've got...
Sound. It's an integral part of our life. It influences our emotions, enhances communication, and provides enjoyment and entertainment. Sound lets us know what's happening all around us.
I'm home.
Can you imagine a world without sound? You don't have to worry about a world of distorted sounds or silence, right? You have your hearing. You don't experience pain in your ears. Approximately 30 million workers are exposed to hazardous noise on the job and millions more off the job. Excessive noise exposure is the most common cause of hearing loss. 1 out of 10 individuals will suffer noise-induced hearing loss that affects his or her ability to understand normal speech. Noise-induced hearing loss is 100% preventable. It's your decision. However, there are no second chances. Noise-induced hearing loss cannot be restored by medical intervention, surgery, or technology. In this program, we'll discuss what sound is, how the body hears sound, the effect noise has on your ability to hear, and the practices and procedures you can take to protect your hearing and ensure a healthy lifestyle. Under normal conditions, a healthy person will not begin to experience a decline in their hearing due to age until they're into their 60s. Unfortunately, noise-induced hearing loss, especially among younger individuals, has increased dramatically. People who are exposed to excessive noise and do not protect their hearing begin to lose their hearing at an early age. A loss of hearing can put others around you at risk. Remember, noise-induced hearing loss is 100% preventable. The first step in protecting your hearing is recognizing and respecting the hazard. What is sound? Sound is a series of vibrations or invisible waves in the air which cause pressure change. These sound waves funnel through the ear opening and down the ear canal. The ear has 3 main parts: the outer, middle, and inner ear. The outer ear is the part you can see. It opens into the ear canal. The average ear canal is about 1 1/4 inches long. The eardrum, a thin membrane tissue, separates the ear canal from the middle ear. The middle ear contains the 3 smallest bones in the human body: the hammer, anvil, and stirrup. The middle ear is a little smaller than the size of an M&M. The inner ear contains a snail-shaped coiled tube called the cochlea. Inside the cochlea are thousands of hair-like nerve endings, cilia. The inner ear is about the size of a pencil eraser. When sound waves travel down the ear canal, they cause the eardrum to vibrate, which starts a chain reaction. The eardrum vibration passes first to the hammer, then to the anvil, and finally the stirrup. The stirrup passes the vibration onto the cochlea. When the fluid in the cochlea vibrates, the cilia move and send an encoded message to the cerebral cortex in the brain that translates the nerve impulses into the sounds you recognize. Exposure to loud and excessive sound damages hearing by overstimulating the tiny hair cells. Once they are destroyed, they no longer transmit sound to the brain. The intensity of sound is measured in decibels. Normal conversation is about 60 decibels. 140 decibels is usually the threshold of pain for most people. When noise-induced hearing loss begins, the high frequencies are often lost first. This is why people with hearing loss often have difficulty hearing the voices of women and children. Loss of high-frequency hearing can also distort sound, making speech difficult to understand, even though it can be heard. Why is this information important to you? By understanding what sound is and the effect it can have on your ears and your ability to hear, you can make decisions to reduce your exposure to noise. As mentioned earlier, the intensity of sound is measured in decibels. A whisper or quiet room is about 30 decibels. Normal conversation is around 60. A lawnmower is approximately 90. Stereo headphones, 100. Snowmobiles, chainsaws, pneumatic drills are around 110 decibels. Music concerts can reach 120, and gunshots and jet engine takeoffs at 140. An important point to note: decibels are measured logarithmically. What this means is, as the decibel intensity increases by units of 10, each increase is 10 times the lower figure. Stereo headphones are 10 times the intensity of a lawnmower. A chainsaw, 100 times as intense. Different variables affect the impact of noise has on your hearing, including decibel level, length of time you're exposed to the loud noise, and proximity to the source. The closer you are, the more damaging it is. Most experts agree that continuous exposure to 85 decibels or more may cause noise-induced hearing loss. Regulatory requirements require audiometric testing on an annual basis for all workers exposed to 85 decibels or more over an 8-hour time-weighted average. Audiometric testing measures your ability to hear sound at different levels. The first option for reducing your exposure to loud noise is through engineering or administrative controls. Engineering controls can include enclosures or covers on machines and equipment, insulation material, mufflers, and equipment design. Administrative controls can determine how, when, where, and the frequency the exposure to noise takes place. When engineering or administrative controls are not feasible or practical to reduce noise to safe levels, personal hearing protective devices must be worn. Personal hearing protection comes in the form of earplugs, earmuffs, and canal caps. Hearing protective devices work by reducing the amount of sound that reaches the eardrum. Different devices offer different levels of protection. Protective devices used in industry must have an assigned noise reduction rating, or NRR. This numerical value provides a general idea of the amount of noise reduction when worn properly. Knowing when to wear hearing protective devices and wearing them properly is a key element in protecting your hearing. Studies show about half of all workers do not receive full protection because the devices are not worn properly. Inspect protective devices before each use. Look for cracks, tears, defects, and other signs of wear that may affect their performance. If you're using a soft plug that can be shaped, roll the plug between your thumb and finger of one hand to make a tight cylinder. Do not twist the earplug, as that will cause creases which may allow sound to leak in. Reach your other hand over your head and pull up and back on your ear to widen the auditory canal. Insert the plug well into the ear and hold it in place until the plug expands to form a tight seal. Remember, your ear canal is approximately 1 1/4 inches in length. A correctly sized earplug is not long enough to reach the eardrum. When putting on earmuffs, center the muff over the ear. If necessary, push your hair away from your ears. The cups should entirely cover your ears. Anything that comes between your ear and your ear muff will make them less effective and reduce your level of protection. In most situations in the work environment, areas or job functions that have been monitored and require the use of hearing protection will be clearly defined and communicated. Your job function may require you to work in multiple locations or in areas where signs and placards are not feasible. 2 general guidelines can help you determine if hearing protection should be worn. If you have to raise your voice to talk to someone who is an arm's length away, then the noise is likely to be hazardous. Second, if your ears are ringing or sounds seem dull or flat after leaving a noisy place, then you were probably exposed to hazardous noise. Err on the side of precaution and wear your hearing protection if you suspect an environment has the potential for hazardous noise. Of our 5 senses, hearing is the one we take most for granted. Noise-induced hearing loss affects both the quantity and the quality of the sound we hear. Some common false conceptions concerning hearing protection include, since I already have a hearing loss and wear a hearing aid, hearing protection programs don't apply to me. Well, if you have a hearing loss, it's important to protect the hearing you have left. Loud noises will continue to damage your hearing, making it even more difficult to communicate at work and with your family and friends. I won't be able to hear warning sounds, such as backup beeps, when wearing hearing protection. Using hearing protectors will bring both the noise and the warning sound down equally. If the warning sound is audible without the hearing protectors, it will be audible when wearing them. Noise-induced hearing loss usually develops over a period of several years. Since it's painless and gradual, we often don't recognize or respect the hazards of noise. Unfortunately, the rate of hearing loss is greatest during the first 10 to 15 years of exposure. That doesn't mean you toughen up your ears or become immune to noise after a period of time. Your hearing ability will continue to decrease. Exposure to hazardous noise will continue to destroy the remaining hair cells in the inner ear. Hearing is an integral part of every function we perform and greatly enhances and affects our quality of life. Protect your hearing, both on and off the job. Understand and respect the hazards of noise. When possible, use engineering and administrative controls to reduce your exposure. Know when and how to use hearing protective devices. Inspect them before each use. Noise-induced hearing loss is 100% preventable. Don't make a decision you'll regret years later. Make the commitment to protect your hearing. It's up to you to decide what to hear.